Hi, I'm Bill Patten, CEO at Holy Cross Medical Center, and today I want to give you an update regarding the May 26th board meeting. This was a regularly scheduled board meeting. As the board always does, it asks whether any of the members have a conflict of interest, and there were none declared at this meeting. The board began by having a report from Brittany Lamondola, our Vice President of Quality. Brittany reported on follow-up from our recent DNV survey. DNV is the company that does our annual inspections. This was a good inspection for us, and she reported on some of the follow-up work that we're doing for the few items that they identified we had opportunities to improve. In addition, Brittany gave a report on our CMS Star Rating. As you may recall, CMS does star ratings 1 through 5 for all the hospitals in the country. And if you go back a few years, we had a star rating of 3, then we went to a 5. Last year we were at a 4, and the recent results that have been reported that cover much of the pandemic year, we fell to a 3. It is actually something that happened to a lot of hospitals across the country. More hospitals saw a decline during the pandemic than saw an increase. This was especially true of smaller critical access hospitals. One of the areas that we scored more poorly this past year was on issues related to visitation, how we communicated with patient families. And if you think about it, during the pandemic, when we actually had limited or at times had prevented visitation, it would be natural to expect that our scores would be lower. But we're not writing it all off to that explanation. We know that there are opportunities for us to improve. Brittany presented the plan to the board of how we plan to grow from 3 stars back to 4 and eventually to 5 stars, the highest rating. Steve Rosenboom, our CFO, gave a report to the board on our finances. He also presented the fiscal year 2022 budget to the board, and they approved it. I'm not going to take Steve's thunder away from him. Watch his video. He'll give you a great update of our financial situation as well as our projections in the budget for next fiscal year. We had a report to the board related to a recent compliance audit. Our compliance program is designed to make sure that our business practices are to the highest standards, that we're doing things at the right time in the right way, and that our billing practices are all up to the standards set by the federal government and our auditors. The compliance report showed that the program is doing a good job of auditing. There were a few items that were mentioned for improvement, but nothing that was worrisome. As was normal, Dr. Cipri Jaramillo presented recommendations to the board for medical staff privileges. Those recommendations were adopted by the board. And as part of the DNV process, I mentioned that we had recently had our DNV survey. The board is required to review at a high level all of the services for which we have contracts. Administration first goes through and reviews those contracts, then the medical staff goes through and reviews them, and ultimately the board gets to review them. So the board reviewed dozens and dozens of contracts as a group. They didn't go through each contract individually, but all of the contracts were approved. This is a process that DNV asks us to do to make sure not only that services have a written contract in place, but that we're evaluating the effectiveness of those contracts to make sure that if any changes need to be made, we're on top of that every year. In my report to the board, I gave a brief update related to the COVID-19 situation. Not as much to report on that these days, and that's very good news. Our vaccination efforts that we've been doing in partnership with the county, the city, the Taos Pueblo, and others are winding down. In fact, the 10th of June will be our next to the last, and the 17th of June will be our last vaccination effort at the Sagebrush Center. We want to thank the Sagebrush. We want to thank Taos Middle School for letting us use their gymnasium. As you may have noted, Taos is approaching 80% of our community as having received at least one vaccination, and almost 70% have been fully vaccinated. We will continue to work with the local pharmacies, local clinics to provide vaccine product to them. For example, Dr. Sylvia Villarreal, her clinic will be providing vaccination to her children, her patients. We're also going to be vaccinating inpatients, ED patients, and any family members of those patients. But we're not going to be holding the big events. As I say, we've pretty much reached saturation in the community. I also updated the board as far as the closing of our annex. So throughout the pandemic, we've been doing specimen collection and testing for COVID-19 at the annex. This was in partnership with the city. That has been winding down. There are some days where we have 5 patients show up. So we will be closing it effective the 10th of June will be the last day that the annex will be open. We updated the board regarding a number of medical staff contracts. All contracts with our physicians have to be reviewed by our attorney and then finally approved by the board. So there were a number of contracts that the board updated and reviewed. We were happy to report to the board that we've reached agreement with the 1199 New Mexico, our bargaining union, for a new collective bargaining agreement. This is a 3-year agreement. It builds in pay increases and some benefit increases for our employees. So we were very pleased with the negotiation effort. We highlighted the work of Martha Jaramillo, Margie Cisneros, Teresa Dalkey, and a few others who were key in us negotiating this important new agreement. We updated the board on our new mammography system. As I reported last month, the board had approved an investment of over $400,000 for this new system. Happy to say that it is installed, it is up and running, so we are providing state-of-the-art mammography services to our community. As part of the most recent coronavirus legislation at the federal level, Holy Cross will be receiving a $230,000 grant that we will use to upgrade some of our systems related to providing care for COVID-19 patients. We're looking at the air handling systems in our intensive care unit and potentially creating a new education area so that when we need to do COVID-19 testing or education, we'll have better resources to do that. We're working to install a new productivity system at the hospital. That software is planned to go live in July. It will allow us to better track our level of staffing with our workload. We're also working to put in a new camera system that requires pulling new cables. It's actually a 10 or 11 week project to pull all of the cables throughout the building, but it will allow us to more than triple the number of cameras that we've got in the building and on the campus so that we can provide better security options. And finally, we're installing a cell phone repeater system. The cell phone signal in parts of the building, the emergency department, imaging department, OR, is less than optimal, and those are areas where our physicians really need to be in contact. So we're installing this repeater system so that we can have a better connection for our physicians and our staff. As I say, look at Steve's video about the financial situation of the hospital. As always, give me a call if I can answer any questions for you. Thank you.